The topic of inflammation is a really common one that comes up in my practice where I mostly treat patients suffering from complex chronic illnesses. A lot of folks are dealing with a lot of neurological symptoms, a lot of pain symptoms, sometimes bladder symptoms, inflammatory digestive symptoms, and so we talk about inflammation a lot. And one of the things that can be a bit confusing is that patients will say, well, we're talking about inflammation, and they'll say, yeah, like I intuitively feel that I'm inflamed. I have all this pain in my joints or muscles, or I'm getting headaches, or I have a lot of head pressure, a lot of urinary tract or irritation. So like I logically think that I'm inflamed, but I was working with my other healthcare provider, and oftentimes it's with their family doctor, and they ran blood tests on me looking for inflammation, and my results came back normal. So I guess I'm not inflamed, or there's confusion there, and that's understandable. If you talk to your doctor and they say, "Hey, we ran this blood work to see if you're inflamed, and everything looks normal," then therefore I guess you're not inflamed. But like many things with related to health and medicine, it's a little more complicated than that. So when folks, and just as per usual, nothing that I'm about to say is should be construed as medical advice. This is just for informational purposes only. And if you have any questions about your own healthcare, please talk to your personal healthcare provider about that. So when it comes to standard blood tests that are looking at in levels of inflammation or markers for inflammation, there's usually one or two tests that are run. One's called the ESR, which is the erythrocyte, excuse me, erythrocyte sedimentation rate. So in other words, your red blood cell sedimentation rate. And the other one is called CRP, or C-reactive protein, or sometimes it will be measured as HS-CRP, which is highly sensitive C-reactive protein. And interestingly enough, I've looked at studies to see is there a big difference between regular and highly sensitive C-reactive protein. Not a colossal amount of difference, but they're still distinct tests nonetheless. So those tests, in my clinical experience, are very, very commonly elevated, so showing signs of inflammation when patients have sort of better understood or more established, shall we say, inflammatory conditions. So if they have autoimmune diseases like rheumatoid arthritis or ankylosing spondylitis or psoriatic arthritis that's causing a whole bunch of pain and inflammation, you're going to see those numbers going up. You're going to see dramatically elevated levels sometimes of ESR or CRP. Or if a patient has a full-blown inflammatory bowel condition like Crohn's or colitis or diverticulitis, and it's not being well controlled, those inflammatory markers are going to jack right up. Or if a patient has something like polymyalgia rheumatica or temporal arteritis, these types of again, more established or well understood inflammatory condition, those markers are oftentimes going to be elevated. And indeed, you can use those levels to actually track how a person's progress is making out. Is the prednisone that they're on working well enough, or whatever the treatment is that's reducing their inflammation. So in those types of health conditions, those markers are really, really valuable, and they're definitely associated with inflammation. However, you take someone with say fibromyalgia, lots and lots of pain there. Oftentimes those markers are going to look totally normal. Or you take a patient with really poorly controlled irritable bowel syndrome, so not full-blown irritable bowel disease like Crohn's or colitis, but we'll say just irritable bowel syndrome. You have tons of bloating, pain, etc. Those levels, the ESR and CRP, will oftentimes look totally normal. You take patients who have diffuse systemic infections with Epstein-Barr virus or borreliosis or Bartonellosis or different or mold toxicity, things that are causing tons and tons of pain, inflammatory symptoms. Many times the ESR and the CRP are going to be totally normal. So there's this distinction between there are certain conditions where the ESR and CRP are very useful, very good at establishing and tracking whether someone's inflamed, and then there are a number of other issues where it does not seem to be a useful marker whatsoever. So, and say with the irritable bowel syndrome example, a patient gets tested and treated for SIBO or LIBO, or they get put on the right type of hypoallergenic diet or whatever it is, and their symptoms get way better. There's this marked reduction in pain, marked reduction in inflammation. We know they're inflamed in many of these cases because oftentimes they'll say, like my weight has gone down, like I'm less, I dropped 5 pounds, in the last week since I've been feeling better. You can't lose 5 pounds in a week, but you can lose 5 pounds of water weight in a week, or inflammation weight, so to speak. We see the same thing when we're treating folks for these chronic infections and things to that effect, mold illness, etc. So that's my explanation in terms of why there can be that seeming disconnect between these inflammatory markers in blood work and them not always regularly in my practice not picking up the inflammation that patients are actually dealing with when they're afflicted by things that aren't an autoimmune condition, or we'll say a more stereotypical inflammatory disorder. So I hope that this was useful information. If you have any questions about this topic or anything else, please post it in the comment section below, and I will leave it there for now.